Okay, this is a picture for the drugs used with heart failure. It's very busy, but all the drugs or the pharmaceutical drugs are in blue. And then you've got the pictures that go along with it. We're going to start up in the corner and move our way around, try to get through this in just a few minutes. When you got somebody that presents with heart failure, you're going to give diuretics. And the story with this is ferocious Amy speared the water chlorinated tank. Now this gets more, in depth in other areas, but right now we're just talking about furosemide, amliteride, spirolactone, the spear, and hydro, the water chlorothiazide. So, the hydrochlorothiazide. So, those are the different diuretics: furosemide, amiloride, spironolactone, and hydrochlorothiazide. Then you get the inotropic agents. These increase contractility. You've got, we're not going to go into a story, but you got digialis here, or digitalis, which is a digoxin is a type of digitalis. Dizialis. Got some, the story could be, she sits on the sodium chloride ATPase and doesn't let it move, and that's kind of the story. So she stops that process, which keeps calcium inside the cell and increases, contractility. The side effects in red: nausea, vomiting, yellow appearing vision. So if somebody says, "I'm just seeing yellow or green or something different," that's a digoxin. Also, any type of arrhythmia that might show up. Take a look at digoxin first. Dobutamine, dopey's butt. So dobutamine also will increase contractility along with dopamine. So we're going to go over here to dopamine. Okay, dopamine. You've got the milrinone, which is a phosphodiester inhibitor. I don't have a picture for amrillinone, but I remember it on Amy Rides Alone. There's a lot of Amy's in here, so don't worry about it, but just try to remember some of those. You got the beta-adrenergics. This is a shortened version of a very elaborate story, but he carved and ate the meat. Carvedilol, atenolol, and metoprolol. Anyway, they all end in lol, LOL. Laugh out loud. You got prazosin, which is an alpha blocker. All these help with the problems with heart failure. Angiotensin inhibitors. And the story here is you've got Captain Prill and Sergeant Less stopped Angie before she could join the Sarton pilots. Okay, so Captain Prill, lisinopril, and the Sartans, and it stops Angie. Now it's contraindicated in pregnancy. You have things like protein in the urine, and with the Prills or the ACE inhibitors, you've got a cough that can be a side effect. You got the vasodilators. You got hydralazine, and the side effect of that is SLE, systemic lupus erythematosus, which will stop with discontinuing the drugs. Got the nitrates: nitroprusside, sodium nitroprusside. All these are to help with heart failure. Keep an eye, just memorize, draw out, learn it again, so if a question comes up, you'll know it.